Hello, this is Dr. Tony Naldo here. I'm talking to you regarding our cool down procedures, passive molding. Today we're talking about posterior T12 blocking. Now, posterior T12 is a very common subluxation pattern that we see with a posterior L5 decreased sacral base. It's when we have like an increased kyphosis of the thoracic spine. Very common subluxation pattern we tend to see. This is how the x-ray looks like when we look at a posterior T12. So you can see if you look at this x-ray, very classic posterior T12. We draw the line up S2 all the way up here. You can see T12 has gone posterior 38 millimeters. Very classic condition when we see posterior T12. We can also see in this thing we have a decreased sacral base and we have a posterior L5. This is our most common configuration when we see a posterior T12. So we can have blocking for it. So the blocking setup is pretty simple. So here you can see in this photo, this is the way the patient will be laying on the blocks. They're going to be using their cervical roll, and they're going to be using the two pelvic wedges set up so the thin side are pointing down towards their feet and the fat side is towards their head, and the blocks are laying on their top, not their bottom. So normally you'll lay the block on this side on the table. We invert them for this procedure. We put both of them right next to each other. Now the spacing between here and the actual cervical roll is going to depend on the size of the patient. We want this ridge to be right on T12. Now this is very firm wedges, which is great because it creates a very sustained force. Again, they want to be laying on this for 20 minutes to have that creep effect to the spine to actually create some motion or to create some very slow deformity to change the spine back into its normal position. So we want to use the creep effect here. So we want 15 to 20 minutes on this. This can be difficult for patients, especially if they have a large posterior T12. Things that you can do to help. One is that you can put something under their sacrum to lift their pelvis off to create a little bit less of a lift between their sacrum and the T12. You can also put something under their thoracic spine to create a lift in their thoracic spine to prevent less of a drop from T12 to the table. You also can put a towel over the top of this ridge right here to create a little softer transition area. But this is a very effective form of blocking to actually improve that T12 area. So you can see here the patient's kind of partially laying down. You can kind of see how the blocks are set up. We have the thin portions towards their feet, the thick portion towards their head, and she's going to put this right on, this ridge right on T12. And when she's fully laying down, she has that ridge right there on T12, and you can see she has her cervical roll that she uses under her cervical spine. Again, you'll be laying this on this for only 20 minutes. This is not meant to sleep on. So let's go through the steps. The indication is done to reduce a posterior T12. It can be used slightly for a decreased sacral base because you can see how she's increasing her sacral base here. But understand the decreased sacral base is actually a secondary effect. Its primary thing is to reduce posterior T12. Instruction is done for a 20-minute period of time. Repetitions are done once per day. And again, it can be done after any cool down phase, especially if the patient has any kind of exercise where they're warming up their spine or causing their spine to flex and bend a lot. They do this right after. A creep can have a greater effect once the spine has already been warmed up. So warming up the spine first with any kind of activity will provide a greater creep effect when they're actually using this. So they can use this after any type of activity or exercise that they perform. So let's go ahead and watch a video and actually how we set up this posterior T12 blocking, and then I'll be back to finish up the video in a second. Hello, this is Dr. Tony Naldo here talking about your home blocking setup. Today's position will be showing something called posterior T12. Posterior T12 is in your thoracic spine and your mid-back kind of falls backwards and moves backwards. Your head tends to move forward. It's a very common subluxation pattern that occurs. So we have a blocking setup to help counteract that. For this blocking setup, you're going to be using your appropriate cervical roll, and then you're going to be using both spinal wedges kind of set up just like this, kind of both of them together with this thin part facing down towards your feet. They're going to be positioned right in the transition area of your low back to your mid back, so kind of like that. And then of course the cervical roll will be under your neck.
And the way you do this is you kind of get your appropriate size once you have this figured out, how far apart they would be. And the simple thing is you just go ahead and lay right down on top of them, just like that. And you can kind of see here, for her this is a little high, so go ahead and stand up. And then you want to make this a little bit lower to get positioned correctly. There you go. You kind of see it's kind of positioned a little lower, so you can kind of see this is her lumbar spine. We're transitioning into her mid-back right here, and that's where we want to have the top of that wedge right there. And these are firm, so they're designed to be firm to actually help lift that thoracic spine, and then you're kind of resting there on your cervical roll. Now, to help take the edge off, if this is a little bit too firm for you, you could put a kind of a towel or a softer piece of foam over the top of those wedges to kind of create a little bit less lift. You can also put something under your pelvis to lift the pelvis up just a tad, like a folded over towel, to create a little bit less of a lift, to help reduce the pressure as you're kind of easing into this. Again, this is a position that you would not sleep on. This is a 20-minute position. However, your doctor will prescribe the appropriate time for you. Some people can go longer, some people are shorter. But it's a very powerful thing to help reduce this posterior T12 shifting, help lift this up, help reduce that subluxation pattern that we so commonly see in our clinics.
So using posterior T12 in office setting could be somewhat difficult. However, patients can pre-block while they're waiting to get adjusted. So you can have them laying face down like this if they have to wait a few minutes for you to walk into the adjusting room to actually get them adjusted. But getting off the block takes a little bit of time, so they can slow you down. So I don't always recommend this blocking for in the clinic. You can use it also as a cool down phase. So after you adjust them and where they're waiting, if you have an ability for them to lay down on any of their blocking, they can do so if you have the room or space in your clinic. However, it's not a very viable blocking system or a pre-blocking system. So normally we just use pelvic rotational blocking or a decreased sacral base posterior L5 blocking, which will probably coexist with this. I find also when I do this blocking that I always do the anterior shoulder adjustment with this blocking, because you can see what it's doing to her shoulders. It's letting her shoulders come back. Now, if you block them and did the drop adjustment like this, it'll probably be a very strong effect. However, I've tried it. It's very difficult for patients to tolerate. They say it kind of hurts because they're in this extreme extension already. But if you do the adjustment and then later on they do the blocking, this tends to help their blocking because you're opening up their pecs and shoulders. So I hope you enjoyed this video and this instructional guide for posterior T12 blocking. Remember, this is a very common subluxation pattern. It can also be used to help increase the sacral base some, but its primary concern or primary force is going to be on that T12 area.